If a woman walks into a hospital in Arizona about to deliver a baby, should she get a doctor's attention? What if she's here illegally? And if you're an undocumented worker with cancer, should you get emergency treatment for your disease? An intense debate is raging between state and federal governments on how emergencies are defined. Bruce Weinstein is known as the ethics guy. He's a columnist with businessweek.com. Hi, Bruce.
Hi, Contessa.
Okay, so now the federal government has told New York officials it no longer will consider chemotherapy as an emergency treatment. If someone comes in and has cancer, is it an emergency to give them chemotherapy?
In some cases, it can be. In fact, there are some diseases of the brain, bone marrow, and spinal cord that do qualify as emergency situations that require chemotherapy. But let's back up. What are the fundamental ethical principles that are the basis of our society? Do no harm and be compassionate. And this federal policy violates both of these principles. It is a political ploy masquerading as sound ethical judgment, and it is wrong. It is cruel. It is immoral.
As it stands right now, though, the federal government is forced to cover emergency treatment for illegal immigrants. So in other words, if they go into an ER, the ER will get some sort of payment, probably not the whole payment, but some sort of remuneration from the federal government to treat undocumented workers. Does our government have a responsibility to cover people's health care? I mean, when there's so many Americans who don't have their health care covered.
Contessa, if you commit murder, if you commit rape, if you molest a child and you go to prison for life, and then you develop cancer, you are entitled to chemotherapy. Why would we offer chemotherapy to the most heinous criminals in our society and deny them to another group of people? And you know what we're talking about here is a very small group of people. This occupies less than 1% of the Medicaid budget.
But you go into some border states, California, Arizona. I know because I've done the interviews before. These people are inundated with undocumented families coming there specifically because they know they can get emergency services, and it's very frustrating for them. I mean, where does our responsibility to do no harm end?
This is frustrating, and I don't want to downplay the significance of this. My heart goes out to everyone on the front lines of this, but it is possible. In fact, it is ethically required for us to have a humane immigration policy that includes caring for people who need our care. I mean, one of the things that distinguishes our country from all other countries, and here we are meeting with the United Nations today, is we pride ourselves on being a caring and compassionate country. And for this policy to go through would really subvert, actually it would violate these fundamental ethical principles of avoiding harm, preventing harm really, and being compassionate and caring. We ought to do it. We ought to put our best foot forward. We ought to show the world that we are a caring society, that we are a good society.
Bruce, thank you for your time.
Thank you.